Hi everyone, I am Dr. Kalai Hema, Consultant Obstetrician and Gynecologist at Seventh-day Adventist Medical Center, Bangalore. I am very glad to be here today to discuss regarding Cesarean section, the common surgical procedure we perform every day. What is Cesarean section? Cesarean section, commonly called as C-section, is a surgical procedure. It is a way of delivering one or more babies through a cut made in the mother's abdomen, that is the lower belly and in the uterus. Everyone has a question how the cesarean section differs from vaginal delivery, that is the normal vaginal birth. In normal vaginal delivery, the baby is born through mother's birth canal, and also it differs from cesarean section in terms of recovery. Little delayed recovery and prolonged hospitalization is required in cesarean section when compared to normal vaginal birth. When do we perform cesarean section? What are the common recommendations for cesarean section? When it is unsafe for mother or baby, then we opt for cesarean section. When the vaginal birth is not suitable because of indications related to mother or the baby, then we go for cesarean section. The common indication is when the labor is not progressing normally. When there is a prolonged dilatation, dilatation is nothing but opening of the uterus mouth, that is the cervix. When it is prolonged and the baby is not born through vaginal birth, then we opt for cesarean section. And when the uterus mouth, that is the cervix, is opened and the baby's head is not coming down, then we go for cesarean section. This is the most commonest indication. And the next indication is when the baby is stressed out or is not able to handle the intra-labor stress. We call it as fetal distress. The baby's heartbeat varies. It is either less or more than the normal average fetal heart rate. It is done in an emergency basis. When the baby is in unsafe position, normally the baby's head has to come down first. When the baby's breech, that is the buttock, comes first, then we opt for cesarean section. When the baby's shoulder or the sides come first, that is the transverse line, then we go for cesarean section. When the baby is very big, then we opt for cesarean section. When the mother's pelvis does not accommodate the baby's weight, then we go for cesarean section, which we call it as cephalopelvic disproportion or CPD. And also some maternal indications. When the mother has medical issues like uncontrolled diabetes mellitus and very increased recording of blood pressure, where normal vaginal delivery is not suitable, we go for cesarean section. And also any umbilical cord related issues, when the umbilical cord is entangled or compressed, then we go for cesarean section. In all these situations, the blood supply and the oxygen supply to the baby is affected and we go for cesarean section.